Hello, I'm Deborah, and I'm the author of the Babbage Parallel series, Reflections on the Decline of Belief in Science and Religion. I'm holding discussions with various experts on the topics covered in the series, which brings me to our guest, Dr. Rowan Francis. Without further ado, Dr. Francis, please do introduce yourself.
Hi there. Nice to be here. Thanks for the invite. I am a cardiologist, a consultant cardiologist in the NHS. I work in Essex, and I also do a little bit of kind of online medical education, science education kinds of stuff. I know we're obviously today going to be focusing on Gen Z, and this has given me, or Z, I don't know what we're supposed to say in this country, but uh, it's given me a bit of a chance to think about these topics because it's probably not one that I encounter on a very regular basis. So it's been quite interesting, sort of learning what's out there on this topic.
Awesome. I think one of the principal things that a lot of people have in mind is that we're seeing young people staying indoors, scrolling on their phones instead of going outdoors, cycling, socializing, playing games, particularly post pandemic. And we're seeing parents afraid of letting their children go out to play alone because of rising crime. So, what does such a sedentary isolation do to someone's long term cardiovascular health?
Well, I think it goes without saying that a lack of activity will have significant impact on cardiovascular health. And I think when we're thinking about young people, this is not something they're going to necessarily experience very quickly. It's more of a long-term thing, but you create a lot of the lifelong habits at a young age. So, if people are having a lot of physical activity in youth, that tends to mean they're going to stay quite physically active later on. Having said that, I couldn't find a lot of evidence to suggest that this is actually um, true. I think during the pandemic, of course, there was absolutely that um, a typical experience of young people, particularly those in education, that they were cooped up indoors and deprived of the social interactions and outdoor kind of activities that they would have previously taken for granted. But now, I was trying to look at, there isn't, I think the first thing to say, there isn't a lot of um, good quality data looking at this demographic because at the end of the day, their health needs are much less when you look at a population point of view. The greatest health needs are towards the end of life. So that's where, all the if you go to a hospital, you'll see the vast majority of people in hospital are much older. So as a result, I think young people have less focus in terms of research, which is I'm not saying is a good thing. That that's a shame that we don't have more information. And a lot of the stuff that I found is kind of what we'd call a bit lower quality. It's maybe more census survey, often by, private companies who are more kind of interested in the space from a marketing point of view. But nevertheless, it seems from what I've read is that actually Gen Z are still quite physically active and a majority will exercise at least once a week. So I'm not sure that we're necessarily seeing a developing long-term problem that isn't one that we already see. I mean, with millennials and the older generations, we already know that there is an obesity crisis, that there is very poor metabolic health overall. I'm seeing younger and younger patients with high blood pressure, with deranged cholesterol, and who are overweight. But this isn't necessarily anything exclusive to Gen Z. I think this is just a continuing pattern, and I don't think there's any evidence to say it's worse with Gen Z. Um, so I think from a physical activity point of view, I'm not too concerned that that's a major issue. But I think, other things that you touched on there, sort of scrolling on the phones and stuff like that, that clearly is a very major difference between, say, your upbringing and mine. I'm a millennial, so I grew up in that pre-internet era, and that I think is a huge factor when we talk about things like mental health, which I'm sure we'll get onto.
That's really interesting, and I think there's a place for that because there's a lot of things in place in school, not just PE lessons, but extracurricular opportunities to perhaps learn equestrianism or to go swimming or to learn football. So there's still a lot of that there when you're young, and there's a lot of that infrastructure that perhaps isn't there when you hit your 20s, and then you have to go and seek those things yourself. You don't get a letter home that says, right, we're going to send this child here on this
Mm.
day by the bus, and it's all organized for them. So I think there's a really interesting divide between Gen Z who are still at school and have all of those opportunities, and there's so much surrounding their health. Then when they have to handle it on their own, do they have those skills? I think it would be really interesting to see whether they then do become more sedentary and scrolling their phones, or whether they actively seek social situations where they're active and going out and about. So I wonder if that will have some level of effect.
Yeah, I think it's probably the case that we're all less physically active after we leave school because we don't have, PE and Wednesday afternoon to go and do sport and everything, which is a shame. I think that would be nice if workplaces introduced a mandatory fun afternoon. But I think, yes, you're absolutely right in that the Gen Z in their 20s are the kind of ones I was more focusing on because they are more, out in the real world and making their own decisions as opposed to having sort of an educational structure. And there we see an interesting uptake in kind of interest in wellness. So that seems to be very popular with Gen Z. And that is more of a concern to me because a lot of the information they're getting and where they're going for information, I think is questionable. And that's kind of one of my interests is sort of the availability of good quality medical education online and sort of trying to explore why it's so confusing. And, in a nutshell, we've gone from a system where you really had a few outlets to get medical information from, to now, a plethora, sort of no shortage of places to get health information. And of course, a lot of those are not particularly reliable. And the biggest medical influencers online, podcasters and people like that, the quality of the information is often very poor. And I think Gen Z, who are, after all, kind of starting out in the world, and I'm no neuroscientist, but it seems that there's a bit of consensus on brain development sort of continuing well into your mid-20s, that these kinds of ideas to a more impressionable audience can lead to quite incorrect views about health. So my own experience, so, again, most of my patients as a general cardiologist are middle-aged or elderly, but we are seeing definite rise in young people being referred into the cardiology clinic. I'm going through referrals this morning, actually. So these are GP referrals that are come into the department, and a large percentage, maybe a third, are young people with palpitations, and there seemed to be a significant elevation in a disorder called POTS, which is postural orthostatic tachycardia syndrome. And this is a kind of poorly understood condition, which has a lot of overlap with other poorly understood conditions which have chronic manifestations without much therapeutic many therapeutic tools available. So I'm thinking things like chronic fatigue syndrome, long COVID, and that seems to definitely have risen, and that's a pattern that I think we're seeing across the board. And of course, I see much less of it than say a GP would. And this, not that they are secondary to anxiety disorders, but there's often a close association. And I think that's a theme that emerges when you look at Gen Z, and there's been lots of writing about this, and often quite opinionated writing, which maybe isn't necessarily based on data, about how this is the anxious generation. And I think it's probably not controversial to say that is true. And but it is a bit of a minefield, and there seems to be a lot of very strong opinions and things like that. So it's difficult to tease apart sort of how much is just people reacting with their gut, or how much is actually, observed with data?
That's really interesting. And I think that's something that a lot of people have noticed. And particularly, I think GPs have sometimes mentioned that if someone becomes famous online with a certain condition, they can suddenly see a wave of young people with that condition. And so,
Mm.
asking whether they have that condition, that sometimes is a little bit of an invisible condition, a little bit complex to diagnose, um, or whether the child is actually suffering with some level of perhaps wanting connection. I think attention maybe is a bit of a buzzword, but perhaps wanting some sort of connection, some sort of community. And I think there are certainly online forums for people with certain conditions that are more nuanced, where people will often dramatize the situation to perhaps upset and concern others. And then you'll see other groups where they're very positive. For example, you might join a forum on Facebook about POTS, for example, and people might discuss the fact that they're worried that really they've got something underlying going with their heart, and that it's something more. And
Yeah.
you might the RNIB community where a woman says, I might be blind, but look at this turkey I've cooked, and look, here's how I did it, and you can all do the same thing, and here's how we can all stay independent even though the traffic light stops are failing. And there can be that slight difference in psychology that I would also perhaps note somewhat. Although the condition is very real, how do we ascertain when it is so nuanced what its actual etiology, or sorry, causation is? Do you find that is an issue, particularly with POTS, working out what is the causation of this, and does it sometimes resolve with age as well? Because that would be very interesting if somebody finds that in their youth they suffered with it more, and then in adulthood they don't go to the consultant very often.
Yes, we do see that pattern. However, there is a bit of a confounding variable in that the mechanism by which people can lose consciousness and faint in a condition like POTS, or even just sort of fainting disorders, not specifically POTS, but young people, especially young women, are most susceptible because the blood pressure is lower. So young women will naturally physiologically have a low blood pressure. So your starting point is quite low. And what happens with the faint is your blood pressure drops quite suddenly, and your heart rate can transiently drop, and it's totally normal. Everyone with a totally healthy cardiovascular system can faint from time to time. It doesn't mean anything, but as you get older, blood pressure creeps up, and your vagus nerve, which is the nerve that regulates your heart rate and things like that, becomes less sensitive. So in young people, we see this oversensitivity of the vagus nerve sometimes, and that can lead to fainting. And people often do grow out of it, and that's absolutely something that we would say. But you're quite right in that a lot of the time, a lot of my role is simply reassurance that there is nothing underlying, and obviously we'll investigate. You can't just say that without doing some additional testing, but you can make the diagnosis just based on history. So there's no sort of diagnostic test for this, but we would rule out if there's any sort of red flag symptoms. If somebody is recurrently fainting, then of course we'd do some monitoring of their heart and things like that. But 99 times out of 100, it's simply a case of reassuring someone, giving them strategies by which they may be able to live a more normal life, because it can be extremely disruptive. But your first point about the rates spiking after somebody famous talks about their condition, or perhaps even simply the increasing awareness of certain conditions. There was one of the first psychiatrist to be president of the Royal Society of Medicine. I've forgotten his name. A few years ago, said quite an interesting quote, which was, I may be paraphrasing here, but his heart sinks every time there's a public awareness campaign for some sort of mental health diagnosis, because then the rates, the referrals for certain things spike up. Now, of course, there's always the chicken and egg situation, that maybe the reason we're seeing more ADHD diagnoses or things like that is simply because that level was always there and it's just being recognized more. And that absolutely is important to consider. But what he was saying is that in a finite capacity system like the NHS, you have to you want to offer the people who are in most need the limited resource. And so he was saying that the clinics get sort of filled with people who, there is something going on, but they are not the kinds of people that necessarily need referral to secondary care. And those in most need are then are getting sort of pushed further down the queue, which I thought was interesting. I'm not saying I endorse the view or anything, but then it led me to read. I was just looking at my bookshelf to see if I can pull it out for you. I don't want to waste time me hunting through it, but there's a book by Lucy Foulkes, Foulkes. I don't know how to pronounce it, who's a psychologist. And it was a really interesting read. She's someone who I think probably a similar age to me, so was at university in the early noughties and had a very severe episode of depression, really quite debilitating. And in those days, there was not much awareness of mental health, and she found it very difficult to talk about. There was a lot of stigma. So she's absolutely in support of the increased discussion that we're having in society and the willingness that people have now to talk about their own mental health and the reduction of stigma. But her thesis was that it maybe has gone a bit too far. And now we are maybe I don't want to say over-diagnosing. I think that's always a little bit of a loaded word, but we are maybe pathologizing some normal variability in mood and life. And I just, in preparation for this, I was just, thought I'd listen to a few Gen Z video essayists and commentary YouTubers. I go to YouTube for most of my information, and just listening to what young people were saying about it. And there seems to be a lot of people saying that, we are kind of romanticizing mental illness and even one term I saw, aesthetizing, like making it some sort of aesthetic, like it's a label. It's not necessarily something that you transiently deal with, and the vast majority of the population will face some degree of mental health issues in their life, and that's important that we all recognize that. But there's maybe the feeling that previously it would be, this is something I'm going to get through and put in my past, whereas maybe now it's more, again, this is subjective, and I'm not necessarily endorsing this, but it's maybe more a label that this is part of my identity. So I don't know, this again, I put the proviso, I'm not a psychiatrist, I'm not a expert in this field at all, but I thought Lucy's account was really interesting because she's become a mental health professional herself now and went through this herself, and I thought that was a interesting account to read.
I've found this really interesting, and I've said this a few times, that I think we sort of hyper pathologize what is the to be expected response to things. It's interesting that in veterinary medicine, if I were to be faced with a horse who has been a racehorse, is the sort of horse that could run at any point, has been abused, and then I put that horse in a situation that it can't cope with and it explodes, I'd be responsible for that somewhat. What did you expect kind of comes to mind. Equally, we can look at people who've been through abusive situations or difficult situations, and we say, this is who you are now, and it's all your fault. And you think, well, actually, hang on a minute. It's not really that surprising that they don't trust people, or that they have this issue, or that they have that issue, because that makes sense for their mind right now. Yes, there's ways we can encourage them to move forward and to see past that and to live in the moment and to recognize that there's wisdom to be acquired over cynicism. But in so many situations where someone has had something happen to them and then their brain is responding in a certain way, I can't help thinking it's pretty clever of their brain, not daft. if a brain is still dealing with something that's happened to it, it's going to shut off to new social situations or shut off to new things that could create more problems, more overload for the brain. And so there's that period of time where people can be very difficult. And it's the same across almost every species you could come across. But it's only in people that it's defined as something wrong with somebody, as opposed to what you should expect. I think we do romanticize mental health issues because it was originally a case of saying, hey, look, my life is still livable despite this thing I have. Next minute, it became, well, this person is quite famous and they've got lots of attention for this, and they're also able to live their special life, and it's something important, and they've overcome all these things, and they're very notable. And children are going to look up to them and see something fantastic about those individuals and may conflate the issue, mental health issue or physical issue that that person lives with their greatness. And it all becomes very enmeshed and confusing. It's not a surprise, I guess, to a certain extent. If you're a young mind, you do mess things up a little bit and get things very confused in your mind. And it seems clear and it's not quite clear at the same time. But I don't think it's helpful for us to encourage a young person to build their life around, particularly a short-term mental health diagnosis, when their life can be wonderful and exciting in many other ways. So I couldn't agree more with that. And I'm wondering somewhat, actually, sort of going on to Gen Z patients in practice, do you find that they're often quite misinformed about things or unnecessarily anxious? Or do you find that actually they're quite amenable, you can get through to them all right, and with the right amount of time, they listen very well?
Oh yeah, certainly the latter. I think as a, I quite like seeing um, patients. I mean, maybe that's just simply because it's a bit of a change from the usual. But now, in a typical clinic of 10 to 12 patients, I will see on a regular basis maybe three or four that are under the age of 35. Um, so. I think as a whole, they are just absolutely, reasonable, and that they will respond to things that I say and take that on board. But a lot of the time, I think there is a mutual frustration because things like POTS, which is probably the number one reason that I would see young people, but other kinds of fainting, it's rare that I will see, you know. More disease of middle and older age in young people. We are seeing quite a few heart attacks in people in their 30s, and that's all related to the usual risk factors. Where I work, there's some of the worst areas of deprivation in Europe, actually. So we will see very, disadvantaged people, and so obviously very high rates of smoking, poor nutrition, and you will see that kind of disease of older age in a younger population. And I think those patients have always been, had the odds stacked against them. I think, if I say, oh, eat, lots of nice vegetables and go for a run, and it's not always the most practical advice. If you're living in poverty, you have very limited options in terms of the food you can buy. Your work is probably not something that is going to offer you a lot of decent work-life balance and opportunities for exercise, probably high stress, a lot of socioeconomic factors that they're dealing with. So I think that is more extrinsic problems that are leading to challenges for that kind of population. But if we think about sort of maybe younger patients in their 20s, then generally I don't, if I have to think in my head of stereotypical patient who's coming with a lot of preconceived ideas about health, it probably wouldn't be somebody in their 20s. I think they're generally quite receptive. there's a high use of wearable technology. That's something that I see more as a cardiologist. Um, and I do that myself. It's not a criticism at all, but I think that can again lean back into the pathologization of normal physiology. So, one of the referrals today, and this is something I see very often, is a patient came to me and they've been reading their smartwatch and seeing their heart rate dropping low, and they want to see a cardiologist. And my response to that is always, are they feeling fine? I mean, if you're feeling fine, just don't worry about what your watch says. Um, and that's not the age group that you're going to run into problems. I think if you're 70 years old and your watch is saying your heart's going slowly, I'd take notice of it. But um, I think there's a lot of tools now available to people, these continuous glucose monitors and smart devices, all of which claim to be able to offer something for your health, some wellness kind of goal, but actually they're not useful in such a young population. You're going to get way more false positives than true positives. And actually, I think it's leading people to have a bit of anxiety about these metrics and these numbers. And by far, one of your questions was sort of, is this population anxious? Absolutely. I think that, but I don't think it leads them to adopt poor health practices or be resistant to what I'm saying. But often I have to remind myself that actually, we've excluded sort of obvious physical pathology with some tests, but I have to remind myself, actually, could this be, could anxiety be driving a lot of this? And I'm getting better at kind of being able to talk about that with patients. I think when I started as a consultant, I'd feel like I may be downplaying their symptoms or anything like that. But I think now they are also quite welcome, that they welcome that conversation, and that somebody understands that actually, they're feeling these real physical symptoms. It's these are definitely real things they're feeling, but that there are other strategies that they can use which may not necessarily seem like they're directly relevant to the heart, but they are more sort of to help with the anxiety that is exacerbating these.
That makes sense. I think sometimes when people come to you with a problem, it's not because they want it to be some big issue, but because they'd like to focus on solving it often. And if you say to them, well, actually, do you have a bit of a health anxiety that's building up from you constantly watching what's going on with your heart rate and other things? Is this actually causing you to become obsessed with it? And if the person's thinking, well, actually, maybe my friend has said that to me, and maybe my mum thinks that might be the case, and yeah, okay, that really could be going on here. I think that can be very reassuring in the right circumstances. If the right tests have been done and it's been proven they're okay, I think that conversation can be extremely welcome. I wonder with regard to health practices, so wanting to be very healthy, wanting to get things right. You talked a little bit about the fact that particularly the information online about how to stay healthy or
Mm.
supplements and all of this
Yeah.
business. Do you notice that? You might notice it more online than perhaps in consult, but do you notice that somewhat?
Oh, for sure. Yeah. I mean, so I think again, there's a bit of um, a gender divide. I think based on a lot of the material that's out there, that's kind of more targeted at men and women. But I'm seeing way higher use of things like testosterone, often at quite a young age, which really concerns me. And performance enhancing drugs. I think there are a lot of uh, people that going to the gym, and there's some data that suggests that performance enhancing drug use among young men is more common than even sort of cannabis. So the main drug taking that is outside of prescription seems to be actually things like steroids and testosterone and stuff like that, and that certainly can have cardiovascular effects. So I'm certainly seeing that. But then I think affecting both sexes, or all people, is orthorexia, which is this kind of abnormal beliefs about diet, where people have become very obsessed with eating clean and things like that. They, have quite restrictive diets, carnivore diet, keto's not so restrictive, but it can sort of lead to quite poor dietary choices because they're hearing very contradictory things. And I'd mentioned these glucose monitors, which I'm seeing a lot. Now these are things invented for type 1 diabetics. You put it on your arm, and they can be absolutely fantastic at giving a continuous glucose readout on your phone. But now we're seeing non-diabetics, and this is kind of encouraged by a lot of the kind of optimization, bro science guys on podcasts. And I've had patients in clinic say that they've stopped eating fruit because their glucose monitor showed that their blood sugar transiently went up, which is totally normal. That's what it's meant to do. And so they're saying I'm just eating like bacon and stuff, and I've cut out fruit because I get a flat line after I eat meat, but I get a spike after fruit. This is all based on stuff they've seen online. So this is and to try and deprogram some of these beliefs is difficult, and I can't do it in 1 or 2 clinic appointments. This takes a long time, so that kind of stuff really worries me, and I think it's only going to get worse because I think the internet now is just proliferated at such a rate that I can see from your face that this is something you hadn't really heard before, but you can and that's the point. You can exist in entirely separate universes online, and people we're not going to have any kind of common ground. So it does worry me. Yeah.
That's really interesting. And I'm thinking also with testosterone that's going to have myriad mental health effects as well, from rage issues, not being able to get on at school or at work. That does seem it does seem absurd. And I see fully what you're saying, that actually the things I've come across, and there's plenty of unhealthy things I've come across, it just happens to be a different set of things. And it's sort of almost an endless list of unhealthy practices you could adopt. And somewhat, and perhaps I'm linking this in somewhat with anorexia and this level of need for control. Sometimes when I'm seeing people who are very addicted to the internet or taking advice from those on the internet, is that there is some link to familial instability, that there isn't this baseline where perhaps they have someone that they trust that can say that's a little bit strange. Maybe you should, maybe we should get you out doing something else. Maybe you shouldn't be on the phone. I do wonder somewhat if there is a link with orthorexia and the need for control in the same way that there is with anorexia. Because my concern is more the state of the person accessing the internet in the first place, for them to want to take that information on board without knowing the person, without knowing anything about that person, than it is about the internet itself to some extent. Do you see some of that history in your patients? Do you sometimes see some of that familial instability, breakdown, cycles of abuse? Do you notice that somewhat?
Yeah, I mean, there's I guess a limited amount that we can cover, and I think that's one of the sad reasons why I think people get pushed to counterproductive kind of health practitioners, sort of non-evidence-based health practitioners, because there are a lot of shortcomings in conventional medicine. And I think lack of time, we all have experienced a very rushed GP appointment because they have to, they only have 10 minutes to see a patient. Well, they have 7, and then they have to sort of document everything. So, 10 minutes is not enough to explore these kinds of issues. And of course, everything you said is true. A lot of the susceptibility someone will have is based on myriad social life events and situations. So absolutely, it's true to say that that kind of thing can predispose people. I don't know, sort of from a familial sort of aspect. I'd be kind of just making a guess, not maybe not a particularly educated one, but yeah, these things can certainly predispose people to look for health information elsewhere. Deb, I'm going to have to go. Um,
No, thank you so much.
Not at all. It was very nice talking to you. Anything else you want to ask or?
Oh, actually, I think we got through quite a lot of it.